Please like, comment and share, and if you have any question then write your question in the comment box. Good afternoon friends. Today we will discuss about the different stages of menstrual cycle. Each month during the years between puberty and menopause, a woman's body goes through a number of changes to get it ready for possible pregnancy. This series of hormone driven events is called as menstrual cycle. During each menstrual cycle, an egg develops and is released from the ovaries. The lining of the uterus builds up. If a pregnancy doesn't happen, the uterine lining sheds during a menstrual period. Then the cycle starts again. A woman's menstrual cycle is divided into four phases: menstrual phase, follicular phase, ovulation phase, luteal phase. The first is the menstrual phase. The menstrual phase is the first stage of the menstrual cycle. It is also when a woman gets a period. This phase starts when an egg from the previous cycle is not fertilized because pregnancy has not taken place. The levels of the hormones estrogen and progesterone drops. The thickened lining of the woman's uterus, which would support a pregnancy, is no longer needed, so it sheds through her vagina. During the period, she releases a combination of blood, mucus, and tissues from the uterus. During menstrual periods, the woman may have symptoms like cramps, tender breasts, bloating, mood swings, irritability, headaches, tiredness, and low back pain. On average, women are in the menstrual phase of their cycle for 3 to 7 days. Some women have more than longer periods than others. The second one is the follicular phase. The follicular phase starts on the first day of woman's period, so there is some overlap with the menstrual phase and ends when she ovulates. It starts when the hypothalamus sends a signal to her pituitary gland to release follicle stimulating hormone. This hormone stimulates her ovaries to produce around 5 to 20 small sacs called follicles. Each follicle contains an immature egg. Only the healthiest eggs will eventually mature. The rest of the follicles will be reabsorbed into her body. The maturing follicles sets off an attack in estrogen that thickens the lining of woman's uterus. This creates a nutrient-rich environment for an embryo to grow. The average follicular phase lasts about 16 days. It can range from 11 to 27 days depending on her cycle. The third phase is the ovulation phase. During ovulation phase, the estrogen levels rise. During the follicular phase, trigger woman's pituitary gland to release luteinizing hormone. This is what starts the process of ovulation. Ovulation is when woman's ovary releases a mature egg. The egg travels down the fallopian tube towards the uterus to be fertilized by sperm. The ovulation phase is the only time during woman's menstrual cycle when she can get pregnant. There are symptoms when a woman's ovulate. The symptoms are a slight rise in the basal body temperature. The discharge will be thicker than the usual texture of egg white. Ovulation happens at around day 14 if a woman have a 20-day cycle, right in the middle of her menstrual cycle. It lasts about 24 hours. After a day, the egg will die or dissolve if it is not fertilized. The fourth phase is the luteal phase. After the follicle releases its eggs, it changes into the corpus luteum. This structure releases hormones, mainly progesterone and some estrogen. The rise in hormones keeps woman's uterine lining thick and ready for a fertilized egg to implant. If a woman gets pregnant, her body will produce HCG, human chorionic gonadotropin. It is the hormone pregnancy test which it detects. It helps maintaining the corpus luteum and keeps the uterine lining thick. If a woman don't get pregnant, the corpus luteum will shrink away and be reabsorbed. This leads to the decreased level of estrogen and progesterone, which causes the onset of her period. The uterine lining will shed during her period. During this phase, if a woman don't get pregnant, she may experience symptoms of premenstrual syndrome that includes breast swelling, pain or tenderness, mood changes, headache, weight gain, changes in sexual desire, food cravings, and trouble in sleeping. The luteal phase lasts for 10 to 17 days. The average length is 14 days. Now, I will tell you about the common issues Every woman's menstrual cycle is different. Some women get their period at the same time in each month. Others are more irregular. Some women bleed more heavily or for a longer number of days than others. The menstrual cycle can also change during certain times of life. For example, it can be more irregular as get close to menopause. One way to find out if a woman having any issues with her menstrual cycle is to track her periods. Write down when they start and end. Also record any changes to the amount or number of days she bleed and whether she have spotting between periods. The birth control. The birth control pill may make her periods shorter and lighter, while on some pills she won't get a period at all. The second is pregnancy. Her periods should stop during pregnancy. Missed periods are one of the most obvious first signs that she is pregnant. The third is polycystic ovary syndrome. This hormonal imbalances prevents an egg from developing normally in the ovaries. PCOS, which is polycystic ovary syndrome, causes irregular menstrual cycles and missed periods. The fourth one is uterine fibroids. These non-cancerous growths in woman's uterus can make her periods longer and heavy than usual. The fifth one is eating disorders like anorexia, bulimia, and other eating disorders can disrupt her menstrual cycle and make her period stop. Thank you.